Hello, how are you? Many people over 50 or 60 years old tell me that they have trouble performing some simple movements in their daily lives. Getting up, sitting on the bed, sitting down and standing up quickly, climbing stairs, walking longer distances. Sometimes they don't have that strength in their legs, or they feel muscle pain after doing these slightly more demanding exercises, like taking a somewhat longer walk. And they think that's normal, just part of getting older. It's bound to happen. But science says otherwise. There's a simple test you can do at home called the chair test, which can determine whether or not you're experiencing a greater loss of muscle mass and strength. This is a process known as sarcopenia, and it should be avoided precisely so we can maintain our independence in old age. Nobody wants to depend on others. So, I'm going to tell you in this video how to do this test at home safely, how to interpret the results, and what science recommends for recovery muscle strength and preserving your muscles, which are so important for you. You're going to love this video. Stay until the end because you won't want to miss it. Before we start, I want to ask you, do you feel discomfort in your legs, that weakness? Did you used to have more strength to climb a flight of stairs, to sit down, squat, or when you're squatting to pick something up, can you get up easily or not? How does that work for you? How old are you? Write that for me down below in the comments. I'd love to see your comment. And don't forget to like the video because that's really important to me. It shows YouTube that you like my channel, that you support and trust my content, and it also helps you because more videos on this kind of topic will show up to help you. As I told you, this chair test can be one of the indicators that can help you figure out whether you really have sarcopenia or not. And sarcopenia is precisely the progressive loss of muscle mass and strength that we experience as we age after the age of 50. This can be accelerated by factors such as a reduction in hormone production, which is physiological in many people, and even a lower rate of muscle protein synthesis. Many people end up developing low-grade chronic inflammation, and many also become increasingly sedentary and less active as they age, and may reduce their protein intake. So this whole combination reduces the body's ability to generate strength in those muscles that are most important for everyday tasks. In our daily activities, it's the leg and glute muscles, the quadriceps and gluteal muscles that can be affected. And that's concerning because we know that sarcopenia, as I mentioned before, this loss of muscle strength and tissue can increase the risk of falls, fractures, loss of autonomy, and make it difficult to perform tasks that used to be simple for you, like picking something up off the floor. And it can even lead to a worse prognosis during hospitalizations. Someone who is hospitalized for another reason due to the loss or reduction of muscle tissue may actually have a poorer health prognosis. So, detecting early on whether you are heading towards sarcopenia or not is kind of like checking your car's brakes before something happens. So, let me explain how does this chair test works, which is a test used in research studies and in geriatric assessments. It's very simple and scientifically validated. You can do it at home. You'll need a chair, right? The chair test uses a chair without armrests about 17 inches high, 45 centimeters, and a timer. It can even be the one on your phone and a safe space around you. So be careful because you'll have to sit and stand up, so make sure you don't hurt yourself on anything, like a dresser that's nearby or a corner, right? So the correct technique is to sit right in the center of the chair. Keep your feet shoulder width apart, okay? Nice and proportional. Cross your arms over your chest. So you don't cheat and use your hands, and stand up completely. Then you sit down again with control without throwing yourself or falling into the chair. And that counts as one repetition. In other words, you sit, stand up, and sit down again without using your arms. That was one. And then in the test, you do 5 repetitions in a row. And you measure the time it takes you to do those 5 repetitions. Got it? So how do scientists interpret this result? Usually less than 12 seconds. That's great. It shows adequate muscle strength for your age. Between 12 and 15 seconds is a warning zone. It's worth starting some preventive actions to strengthen your leg muscles. More than 15 seconds already indicates a significant loss of strength. And then they recommend an evaluation with a healthcare professional. Remember that this video is for informational purposes only. My goal is to make you realize that this is important for you. If you have any questions, talk to your healthcare professional, your doctor, your physical education teacher, or your physical therapist in your city. If you can't do the 5 repetitions without using your arms, this indicates even greater muscle weakness and a need for further investigation. So always remember that this is not a diagnosis, as I told you, right? This is called early identification. These values have been validated in scientific studies that relate the speed of this test to muscle mass, risk of falls, and functional capacity in the future. So it's really important. I suggest you try it and then write your result for me here in the comments. So why does this test work so well? The movement of standing up and sitting down mainly involves the quadriceps, which are the muscles at the front of the leg, the glutes, the hamstrings at the back of the leg, and the core, which is related to the belly and abdomen. So this neural system that coordinates balance and speed also ends up being assessed in this test. So it ends up involving a large amount of muscle tissue, and it can check whether there is muscle loss or not in these large muscle groups, and also how the neurological aspect involved is doing. So if you notice that you have a greater tendency to lose muscle mass, it's important to do something about it, right? You shouldn't just take in this information and go on living your life as it is. Remember that two things help increase muscle mass: healthy eating and physical exercise. One without the other can't deliver good results. So nutrition is super important because to build muscle, you need protein, which is the building block of our muscles, right? So remembering to consume an ideal amount of protein is super important. Usually in these cases, we can recommend 0.5 or 0.6 grams of protein per pound of body weight. So if you weigh about 160 pounds, that's roughly 80 grams of protein per day or more. It's not 80 grams of chicken, okay? So that's an important point. If you're not exactly sure how much is that, there are apps out there that can help you with that. If you have any questions, consult a nutritionist in your city. But remember that good sources of protein are eggs, meats, fish, chicken, yogurt, and even legumes, right? Peas, beans, lentils, chickpeas, tofu. So all these foods are sources of protein, and you can include a little bit of them throughout your day to ensure a good protein intake. Remember to consume protein after your workout. This is a key moment for you to consume protein for muscle building, and preferably with carbohydrates to optimize the absorption of these amino acids and help them enter the muscle more easily. And remember vitamin D as well. Low levels are common and can reduce strength and increase the risk of falls. So supplementation obviously should only be done after evaluation by a doctor or nutritionist. And I have a really cool video here talking more about this as well. I'll leave it down below in the description for you. Regarding this part about muscle building through physical exercise, ideally you should seek out a physical education professional or a physiotherapist to help you. Scientists recommend a plan for muscle activation, progression, and strengthening, which basically involves doing these repetitions. You start with 8 repetitions, sitting down and standing up. You rest for 1 minute and do this 3 times, right? This is called 3 sets. After you improve, you can progress to doing squats without any support. And then, as you continue to get stronger, you can advance even further by doing squats while holding a 2-pound water bottle in each hand for added resistance. Ideally, you should seek guidance from a physical education professional so they can assess your situation, or a physical therapist in this case, which is also very important. So if you have any questions, consult a professional in your city. The main thing is to remember that you need to work your muscles for them to grow. Because just eating protein and staying on the couch won't build muscle, It doesn't cause hypertrophy. And that's an important point for us to remember. Remember to check out the videos I'm going to leave below to help you further. And let me know what your result was on the test. I would love to see your comment. Leave a like on the video to help me out too. And share it with anyone you think could use this tip. Let's grow our chain of kindness. That's what I want here with the channel. See you next time. Bye.